Welcome everyone to the Southeast Michigan Senior Regional Collaborative. I am Christy King, the Association Executive, and I want to welcome Dr. Jean Wright from the Virtual Dialysis Support Centers as we talk a little bit today around suicide prevention. The SRC will be hosting a few workshops, a few QPR, question, persuade, refer, training certification workshops in the near future. And we wanted to have a conversation with Dr. Wright around the importance of suicide prevention. Welcome, Dr. Wright, for joining us today.
Thank you. Thank you so much. I am so excited to be here today to talk about suicide prevention for our older generation and for people with disabilities. It's a very important topic.
Absolutely. So talk to us a little bit about how and why you chose to begin this journey around suicide prevention for virtual dialysis support centers.
Working with people with who are on dialysis and those who are walking this walk, we found that there are some who find it so challenging that they are ready to just give it up and just give up. And so working so closely with our clinics, we wanted to make sure that our clinics have what they need to be able to address this situation with the dialysis patients. And so I personally became licensed to be able to provide the training for clinic staff to be able to help our dialysis patients when things get to this point. And yeah, it really is not a matter of if, because there are going to be some that are just without hope, we can say, without hope. And they will need this training. They will need to be able to help them in the process of holding on.
Absolutely, absolutely. I know as a former dialysis social worker, the staff, there's so many things coming at you in the dialysis unit. It's important that we have additional tools in our toolbox to help us recognize some things that sometimes we just talk to one patient, we go to another patient, but sometimes we need something to help us listen a little bit better and provide us with some additional tools to help our patients. So with that in mind, what are some statistics for older adults and persons with disabilities around suicide prevention? Because we often think that suicide just pertains to a younger population or a younger generation.
That's so true. That is so true. And what we found is that those 65 or older, we have found a tenfold increase within the past 10 years of those who are actually completing suicide. And we found that men 85 years and older are at the highest risk. And those happen to be white men 85 years or older, but Black men are catching up, which is not good. And what we see is that when you look at the younger generation, we normally focus on ages 15 to 24, and we say that's the highest age group. And it would be, but when statistically, the older generation, when they attempt suicide, 1 in 4 of them will succeed. Whereas that younger generation that we just spoke of, 1 in 25 attempts will succeed. And so the older generation is especially at risk because they actually know how to get it done. And so we really want to target this generation especially.
Wow, those are some alarming numbers to think about. And so it kind of leads to what are some myths associated with suicide in our older adult population? Because those numbers, I would have never thought that 1 in 4 of our older adults or persons with disabilities would actually succeed in those attempts.
Exactly. And what we find is that people are saying, well, if I mention it, well, then I'll plant the idea and then they'll start thinking about it. And that is nonsense. That is total nonsense because a person is either thinking about suicide or they are not thinking about suicide. There is not a way to plant the idea. That's a myth. And another myth is that they're not going to say anything. You won't be able to know if a person is having that ideation. Again, another myth that needs to go out the window because they are always speaking. They're saying something or they're doing something to let us know. The problem is that we don't know how to pick up on it. So people are speaking, and especially within that 1 week window. If we can catch them within that 1 week window with something that they said or something that they did, well, then we stand a better chance of helping them. And then a third myth is that, well, if a person is going to commit suicide, they're going to commit suicide. There's nothing you can do. Nonsense. nonsense, because now we know that suicide is the most preventable mode of death that there is. And so we want to throw those three myths out the window right away, right away.
Absolutely. We want to foster hope. You know, with QPR, I think the
Yes.
program fosters hope for those persons and gives you those tools to help people foster hope in these instances. So in that conversation, what are some resources available that the social work staff or other staff or other professionals or even just direct caregivers may use and utilize if they are concerned about their loved one or a patient or client that they're working with?
Exactly. Now, there's some easy to remember numbers. 1-800-SUICIDE is one that a person can call, 1-800-SUICIDE, or 1-800-273-8255 is another one, or 800-784-2433, or you can text the word home to 741-741. And I want you to know that those people respond. They respond right away. Those are excellent resources. Yes,
Absolutely,
indeed.
absolutely, absolutely. Well, I want to thank you for joining us today for this short conversation, just to begin to have some thoughts around suicide prevention. Once again, the SRC will be hosting a couple workshops moving forward around QPR. And those suicide prevention training certifications, our first one will be June 16th. From 11 to 1. Our second one scheduled is September 15th from 11 to 1. We do have limited space in those workshops, so we are asking people to make sure to register early. And you can go to our website for the Southeast Michigan Senior Regional Collaborative at semisrc.org, or visit the virtual dialysis website at vdsccares.com to register for these workshops. Once again, we want to thank you, Dr. Wright. We look forward to having additional conversations with you around suicide prevention in our older adult populations. And we really look forward to our certification trainings coming up in the near future. Once again, thank you, and thank you for joining the Southeast Michigan Senior Regional Collaborative around suicide prevention. Have a great
Thank
day.
you. Thank you.